What if I told you the weeds you've been poisoning all summer are the same plants that kept your great-grandparents alive during the Depression? And modern labs just confirmed they were right. Right now, you're spending hundreds on first aid supplies while destroying a free pharmacy growing in every crack of your driveway. Chemical companies convinced you these plants were your enemy. They lied. In the next 12 minutes, I'm walking you through 10 backyard weeds ranked by survival value, how to identify them, what our ancestors used them for, and what science now proves about their healing compounds. By the end, you'll never look at your lawn the same way. These aren't random plants. They're ranked from simple relief all the way up to critical survival medicine, the kind frontline medics reached for when everything else ran out. And when we hit number 6, you'll see the plant Civil War soldiers called life medicine, the one medics reached for first when morphine ran out. Number 9 is the weed currently growing in 90% of American yards that trauma surgeons are now studying for battlefield wound care. Yes, that common. And number 1, it's the forgotten frontline remedy for the one injury that sends more people to the ER than anything else, and it works in under 60 seconds. Every plant on this list grows without permission, fertilizer or pesticides. They've survived because they work. Our ancestors knew it. Science is finally catching up. Let's start. Number 10. Plantain, the blister breaker. Those broad green leaves with parallel veins growing in every lawn, sidewalk crack and hiking trail in America. Native Americans called it white man's footprint because it followed European settlers everywhere, and they immediately started using it. Depression-era mothers kept crushed plantain leaves in their apron pockets during field work. When a child got stung by a bee or scraped a knee, they'd chew a leaf and slap it on the wound. Instant relief. Here's why it worked. Researchers identified orcubin, an iridoid glycoside that inhibits the same inflammatory pathways as ibuprofen, KIO-X2, without systemic absorption. Plantain also contains allantoin, a compound that promotes skin cell regeneration. It's used in modern wound care formulations today. The original application was simple. Crush a fresh leaf. Apply it directly to bites, stings, blisters, or abrasions. The plant draws out venom and irritants while cooling inflammation. Broadleaf plantain works best. Mature midsummer leaves have the highest mucilage content for that drawing action. It's safe for external use on broken skin. That's plantain, the first thing you reach for when something bites, stings, or blisters. Number 9. Chickweed, the itch eraser. Delicate star-shaped white flowers, sprawling across shaded ground in spring. European herbalists used chickweed baths for eczema and psoriasis since the medieval period. It's documented in Anglo-Saxon medical texts. Appalachian communities called it itchweed and used it for poison ivy rash. If your skin was on fire, chickweed put it out. Modern studies demonstrate the mechanism. Saponins in the plant create a mild detergent effect that lifts irritants off the skin surface while cooling inflamed tissue. It also contains vitamin C and gamma-linolenic acid, both studied for skin barrier repair. The traditional use was an infusion added to bathwater for full-body relief, or a fresh poultice for localized rashes, poison ivy, heat rash, hives. One critical note: chickweed loses potency fast after harvest. Use it fresh or recently dried, ideally before it flowers. It's safe for external use. When your skin is screaming and nothing else is working, chickweed ends it. See how this works? Now let's expand what these plants can do. Number 8. Purslane, the omega weed. Thick, succulent red stems and paddle-shaped leaves, sprawling flat across garden beds. Ancient Greek physicians prescribed it for cooling inflamed gums and mouth sores. Medieval texts listed it as a scurvy treatment. Sailors ate it raw when they could find it. Here's what makes purslane remarkable. It contains the highest concentration of omega-3 fatty acids, alpha-linolenic acid, of any leafy green on Earth. Researchers have confirmed its anti-inflammatory mechanism operates at the cellular membrane level. It also contains betalain pigments with antioxidant activity, comparable to synthetic vitamin C in oxidative stress models. The original use was direct. Eat it raw in salads, cook it as a poch herb, or crush it fresh and apply it to mouth sores and gum inflammation. Young plants before seed formation are best. The stems and leaves are both edible, and the omega-3s survive like cooking. One caution: purslane contains oxalates, so if you have a history of kidney stones, moderate your intake. Topical use has no contraindications. This is the weed you've been pulling from your garden that could have been cooling your inflammation for free. Number 7. Dandelion, the digestion reset. Yellow flowers, jagged leaves, white sap in the stem, every lawn in America. Persian physicians in the 10th century documented dandelion root decoctions for liver complaints and sluggish digestion. Pioneer settlers used spring dandelion greens as a tonic after winter months of salted meat and preserved foods to restore digestive function. Modern mechanistic studies show why. Sesquiterpene lactones in dandelions stimulate bile production by 40 to 50%, improving fat digestion and reducing bloating. The root contains inulin, a prebiotic fiber that feeds beneficial gut bacteria. Controlled trials show it alters microbiome composition. The traditional preparation was simple. Simmer the root for 10 to 15 minutes, drink the tea for digestive support. Young spring greens can be eaten raw or cooked for mild diuretic effect. Full harvested roots have the highest inulin content. Spring greens are the least bitter. Avoid plants from chemically treated lawns. Dandelion may potentiate diuretic medications, and those with bile duct obstruction should consult a practitioner. But for most people, this is the bitter spring tonic that resets your gut after a long winter. Number 6. Red clover, the cough tamer. Purple-pink globe-shaped flowers in grassy fields. Russian folk medicine used red clover tea for chest congestion and persistent cough during brutal winters. American eclectic physicians in the 1800s listed it as an expectorant and lymphatic cleanser in their official formularies. Modern respiratory pharmacology explains the mechanism. Isoflavones, genistein and digoxin, thin mucus secretions by altering glycoprotein structure. Red clover also contains coumarins, which provide a mild antispasmodic effect on bronchial smooth muscle. The traditional use was an infusion of the flowers for cough and upper respiratory congestion, often combined with other expectorant herbs. Use fully opened, blossoms. Dry them in a dark, cool location to preserve isoflavone content. Avoid mouldy or browned flowers. One safety note, red clover contains coumarins, so avoid high doses if you're taking blood-thinning medications. As an occasional tea, it's generally safe. When a cough settles deep in your chest and won't break, red clover loosens it. We've covered skin, digestion, and lungs. Now we enter survival territory. Number 5. Yarrow, the soldier's heal-all. Feathery leaves, flat white flower clusters, grows wild in fields and roadsides. This plant is named after Achilles, who reportedly used yarrow to stop soldiers bleeding during the Trojan War, Greek legend preserved in Pliny's writings. Civil War medics carried dried yarrow in their field kits for hemorrhage control when medical supplies ran out. It's documented in soldiers' letters. They called it life medicine. Here's what modern hematology confirms. Yarrow contains achillin, an alkaloid that accelerates clotting time by promoting platelet aggregation. It also contains flavonoids, apigenin and luteolin, that reduce capillary permeability and inflammation at wound sites. Topical application has been studied in traumatic injury models. The traditional battlefield use was immediate. Crush fresh or dried leaves, apply directly to cuts, lacerations, nosebleeds. A strong tea was used as a wound wash for antiseptic and astringent effect. Flowering tops contain the highest alkaloid concentration. Harvest in full bloom. Crushing or chewing the plant activates the compounds instantly. External use is preferred for active bleeding. Yarrow can cause contact dermatitis in individuals allergic to the ragweed family, but for most people it's safe. When blood won't stop and you're far from help, yarrow stops it. Before we continue, if this knowledge deserves to reach someone who's tired of depending on a system that profits from their ignorance, hit that like button. The algorithm doesn't care about truth. You do. Let's make sure this doesn't get buried. Number 4. Mullein, the lung liberator. Tall stalks with yellow flowers, large fuzzy leaves in a ground rosette. Ancient Greeks burned mullein leaves and inhaled the smoke for respiratory ailments. Hippocratic texts reference it for cough. Appalachian herbalists made asthma cigarettes from dried mullein leaves. They also prepared strong leaf tea for tuberculosis patients in the pre-antibiotic era, when TB was a death sentence. Modern pharmacology explains how it works. Saponins in mullein increase surfactant production in the bronchi, reducing mucus viscosity at the mechanistic level. Mucilage coats inflamed respiratory membranes. Verbascoside exhibits antimicrobial activity against common respiratory pathogens. The traditional preparation was a long infusion of the leaves, strained carefully through fine cloth to remove the irritating hairs, then consumed for cough, bronchitis, and chest congestion. Mullein flower oil was used as earache drops in the external ear canal only. Use second-year flowering stalks. First-year rosettes lack therapeutic concentration. Always strain the tea thoroughly. Those fine hairs can irritate your throat. And never use earache oil if the eardrum is perforated. When your lungs are drowning and you can't breathe, mullein clears the way. This is where it gets critical. The next 3 plants aren't just nice to know. They're the ones you'd pray were growing nearby in an actual emergency. Let's go. Number 3. Self-Heal, the cut closer. Low-growing purple flower spikes, square stems, spreads across lawns. Medieval Europeans called it heal all, and applied crushed leaves to sword wounds and farm injuries, documented in 13th century herbals. Chinese medicine used it for over 2,000 years under the name Xiaoku Chao, specifically for infected wounds. Modern microbiology confirms the mechanism. Rosmarinic acid and ursolic acid demonstrate antimicrobial activity against Staphylococcus, Auris and E. coli, the most common wound pathogens. Self-Heal also contains tannins that provide astringent action, tightening tissue and reducing bleeding. Polysaccharides in the plant stimulate immune cells at wound sites, specifically macrophage activation. The traditional use was direct: fresh or dried leaf poultice for cuts, scrapes, and infected wounds. A strong tea was used as a wound wash or gargle for mouth and throat sores. Harvest the flowering tops for maximum concentration. Fresh plant is preferred, but it dries well. Rapid application to fresh wounds is most effective. It's generally safe for topical use. When a cut risks infection and you have no antibiotic ointment, Self-Heal closes it clean. Number 2. Shepherd's Purse, the bleeder stopper. Small white flowers, distinctive heart-shaped seed pods. Ancient Chinese military texts describe soldiers carrying dried shepherd's purse for battlefield hemorrhage. It was used extensively in World War I by medics on both sides, when standard clotting agents were unavailable. Official adoption documented in medical journals of the era. Modern vascular studies demonstrate the mechanism. Fumaric acid and other organic acids induce vasoconstriction and promote clot formation. Peptides in the fresh plant juice exhibit hemostatic activity superior to control groups in animal bleeding models. Trauma surgeons are now studying shepherd's purse for battlefield wound care applications. The traditional use was immediate and direct. Crush the fresh plant, apply the juice or poultice to actively bleeding wounds. A strong tea made from fresh or dried plant was used as a styptic wash. Critical: it must be used fresh or freshly dried. Active peptides degrade rapidly. The heart-shaped seed pods confirm identification. External use as a styptic is safe. Internal use as a tea should be avoided during pregnancy due to uterine-stimulating properties. When bleeding won't stop and every second counts, shepherd's purse stops it. Faster than anything else in your yard. I need you to remember something. For 99% of human history, there was no 911, no pharmacy, just the ground beneath your feet. Here's the plant that made that survivable. Number 1. Comfrey, the bone knitter. Large hairy leaves, bell-shaped purple or white flowers, deep taproot. Greek physician Dioscorides in the 1st century AD named it symphytum, meaning grow together, and prescribed it for broken bones and torn ligaments. European bone setters applied comfrey root poultices to fractures and sprains as standard practice for centuries. In rural England, they called it knit bone. Modern cellular biology confirms exactly why. Allantoin in comfrey directly stimulates osteoblast proliferation and collagen synthesis. It accelerates fracture healing at the bone tissue level in controlled studies. Rosmarinic acid reduces inflammation and edema around injury sites. Topical application has been studied extensively in sports medicine for blunt force trauma and sprains, the number 1 orthopedic injury category in emergency rooms. The traditional use was a poultice of fresh or dried root or leaves applied to sprains, strains, bruises, and closed fractures for external support. Infused oil or salve for repetitive strain injuries and joint pain. The root contains 10 times the allantoin concentration of the leaves. Harvest mature roots in the fall of the 2nd year. Here's the critical safety note: external use only and only on unbroken skin. Comfrey contains pyrrolizidine alkaloids that are hepatotoxic if absorbed into the bloodstream through open wounds or taken internally in large amounts. Never apply it to open wounds, deep cuts or punctures. Avoid internal use entirely. Teas and tinctures carry liver toxicity risk. Topical use on intact skin for closed injuries is the safe, validated traditional application. When used correctly, Comfrey reduces pain and swelling from a sprain in under 60 seconds. That's why it's number one. For 200,000 years, humans survived because they knew the ground beneath their feet. In the last 100 years, we were taught to fear it, poison it, and pave over it. Every single plant on this list is proof that nature didn't abandon us. We abandoned nature. These weeds grow in sidewalk cracks and parking lots because they refuse to let us forget. The medicine was always here. We just stopped looking down. If you want to become the person in your family who knows what to do when the grid goes down, the pharmacy's closed, or the supply chain breaks, subscribe now. This channel exists to restore the survival knowledge your great-grandparents died with. Don't let it disappear again. Go outside right now. Find one plantain plant. Wide green leaves, parallel veins. Grows in every lawn in America. Pick one leaf, crush it between your fingers, smell it. You've just activated the same remedy a Civil War medic would have used. You didn't need permission, a prescription, or a credit card. That's the point. Start there. Here's my question for you. Which of these 10 plants is growing in your yard right now? And which one are you going to try first? Drop it in the comments. I want to know who's actually going to do this.